right, guys, good to have you guys again on top of the show this morning. Good morning to everybody where they join us for the very first time. Remember, I say this is now your number one family entertainment channel. And like you know, say every Saturday, once it's 8:30, Health Matta, they always share it on top of the channel where they carry everything where they relate to health. Because say your health now wealth, your health is important. If you want to see tomorrow, they tell me it depends on how you take care of your present health. And that now why we know they use anything that has to do with your health play on top the channel. And obviously, who is slimming to want to do this alone? I'd always get with in-house doctor. I mean, it's a person that is certified when it comes to everything that has to do with health. I mean, Dr. Barth. And guess what? Today is a special one because he not just come alone, no. He carry somebody with sabi too. I mean, somebody we're going to talk about waiting with the share or waiting they share every first Wednesday for the month of May. But then they choose to talk about them today because we know say Health Matta no go dey share on a Wednesday. Do you understand? So that's why Dr. Barth think I said, okay, I think it's just better for us to bring somebody that has to do that knows it and that can talk so much about it. What I'm going to talk about, I will allow Dr. Barth tell you guys. But I just came to introduce the show, and definitely anytime from now, Slim will be going on a quick break. But let me say hi to Dr. Ufoegbunam.
Yeah, slimmest of them.
Doctor.
Thank you very much for your kind words.
No, then I was actually speaking.
You're looking sweet as always.
Trying to be like you.
In high spirits. Ready to fire.
Yeah, so very ready to go.
Yeah, thank you very much.
All right, Doctor, do you want to tell them a bit of what to expect?
Yes. Good morning, viewers at home and around the world. We're happy to be back this morning on Health Matta, your regular weekly TV show. Today we'll be talking about uncovering asthma misconceptions. Uncovering asthma misconceptions. Why did we bring this topic today? 5th of May is going to be World Asthma Day, WAD, World Asthma Day. Subsequently, after this year, it will be held on every first Tuesday of May in subsequent years. Now, it is a time that will create awareness about the dangers that this disease entity can actually pose to humans. What is asthma all about? Let me start with global affectation. According to WHO, it is estimated that about 339 million people across the globe have this condition, suffer from asthma. And of course, in 2016 alone, it cost about 417,918 deaths on a global scale. So it is a disease that can kill if it is not well managed.
Okay. All right. What a way to start. So I think it's just okay for us to go for a break. When I come back, Doctor and our guest today, could you sit down? So guys, go nowhere, touching not. We'll be right back.
Thank you very much. Good morning once again. We are glad to have you back. With me in the studio today or this morning is Dr. Femi Omotosho. He is a public health physician. Dr. Femi, you're welcome, sir.
Yeah, thank you, Dr. Barth.
Thank you very much.
Good morning, our viewers.
Yeah, and today we'll be talking about asthma. I've said that the theme of this year's World Asthma Day is uncovering asthma misconceptions. And of course, we just watched a video clip a while ago that showed some of the misconceptions that people have about asthma. Some of which are that asthma is a childhood disease, that oftentimes it will go away as a person ages along. And of course, that asthma could be infectious or contagious. We have an expert in the building that will explain all of this to us. But first, I will give you an idea of what asthma is all about. Asthma is a disease that affects our lungs. It causes repeated episodes of wheezing and breathlessness. In other words, it is a disease condition or a clinical syndrome of chronic airway obstruction that oftentimes can affect the way we breathe. It presents with wheezing. What is wheezing all about? Noisy breathing, as if one is trying to push air or to blow air through a tight pipe. Oftentimes, if you sleep around someone that has asthma in the middle of the night, you could hear the noises that the person is making when he breathes in and out. That is called wheezing. And of course, it presents also with chest tightness and cough and difficulty in breathing. typical of some of the symptoms that we can see in today's coronavirus contagion or disease. So, but this morning we have an expert in the house that will be explaining to us this morning all we need to know about asthma. So once again, I'd like to yield the floor to the expert in the building.
Yeah,
You're
thank
welcome.
you.
Yeah, so
Thank you very much, Dr.
yeah,
Barth,
thank you very much.
for the introduction. And once again, good morning to all our viewers all over the globe.
Yes.
So, as Dr. Barth has said, uh, every first Wednesday in the month of May, usually the World Asthma Day is usually celebrated, and ditto for this year. So, and the theme for this year's World Asthma Day is uncovering asthma misconceptions. And this theme is very apt in the sense that asthma is a disease condition that has over the years been bombarded with different misconceptions, both in developed nations and even in developing countries. And so we, this morning, try to go through some of these misconceptions and then try and clarify what truly asthma is. So as Dr. Barth has rightly said, asthma is a chronic condition of the lungs. Basically, this morning, I wouldn't want to use medical jargons. We are doctors, but I want to come to the level of our audience so that we can really understand what asthma is.
Yes.
So the first thing basically is that asthma is a chronic condition. So I said, and what that means is that for most of the time, asthma in an individual is a lifelong condition. Just like we have chronic conditions like hypertension, diabetes, that are not necessarily cured. So it is with asthma. Asthma is a chronic condition. And the main problem in asthma is there's what we call an underlying airway inflammation. What that basically means is that, again, to come to the level of our audience, is that the airway normally is meant to be free of any obstruction. When people with asthma, usually the airway usually is filled with fluids and is usually inflamed. When you say something is inflamed, it's swollen. So over time, the airway is not free. So you have some form of internal blockage. Usually the airway is filled with fluids, filled with mucus, filled with secretions. And over time, it affects the way the individual will be able to breathe. And that's basically the issue with asthma. And usually it's chronic, meaning it's always there. What now causes an individual to either come down with symptoms or come down with an attack, as it's called, is usually dependent on how much of that inflammation is present and how much it's hindering the person's ability to breathe. So basically, that's what asthma is. But as you said, what we are focusing on this World Asthma Day is about the misconceptions about asthma.
Okay, thank you very much for that intro. I would like to ask you, what are the types of asthma? What are the types of asthma? So let's start from there, sir.
So thank you very much, Dr. Barth, for that question. Very apt. Types of asthma, depending on, there are several classifications for asthma, but I would want to come down to the common ones, especially the ones usually used by the Global Initiative of Asthma, that's GINA. One, asthma could be classified based on the age category, and that one is very simple. We have childhood asthma, we have adult onset asthma, meaning childhood asthma are the ones that usually starts as early as in the infancy years, that's in the first year of life, and then most of the time it continues through life. And also, it's possible for an individual to live his or her first few decades of life without having anything of asthma. And thereafter, at the age of 20, 30, 40, we've had cases in which people develop asthma in middle age and very few in elderly. So that's one common classification of asthma, childhood asthma or adult onset asthma. There are also other types. There are job-related asthma, which is becoming more in this era of issue of pollution, global warming, and everything. Then if we now want to go to the issue of classifying asthma clinically, which more now deals with health professionals. The one I talked about, we can easily relate to it. You don't need to be a health professional to know adult onset childhood asthma.
Exactly.
But for clinical classification, we have what we call intermittent asthma and persistent asthma. So for that, it's more clinically related. I don't want to go too much into that. But what that basically means is that intermittent asthma means asthma that is not always there. It comes once in a while, on and off. While persistent asthma means asthma that is always there. And for persistent asthma, we can also classify it into mild, moderate, and severe.
Exactly.
So I don't want to go too much into that.
Yeah,
so
thank you very much.
Our audience. Thank you.
Yeah, thank you very much for that. And let me put this in a layman's perspective. What causes asthma? Are there different causes for asthma, for childhood asthma, and for adult onset asthma? Are they different causes or are they caused by the same thing? When we watched that video, or we heard about the misconception that has to do that asthma, the fact that asthma is a childhood disease has been debunked, and the fact that people can overgrow or that asthma can actually leave them with advancement in age. How true are all of these, sir?
Thank you very much, Dr. Barth. For asthma, yeah, people always ask, what's the cause of asthma? Once again, I would like to clarify for our audience to understand. Asthma is called a heterogeneous disease. That's a big word, but I'll break it down. Heterogeneous disease. What this means is that asthma usually does not have you can't pinpoint that this is just one cause of asthma. Asthma is, in simple sense, or in simple terms, is multifactorial. That's why it's called a heterogeneous disease. And that's why you see someone will tell you, my own asthma is usually when I'm exposed to smoke. And someone will tell you, I have symptoms when I'm stressed up. So asthma is multifactorial. There are different factors that could lead to asthma. So now when we're talking of what are the causes of asthma, it's difficult to pinpoint it to one, but there are some factors that we know when present, then the likelihood of asthma is increased in such individuals. Factors such as parental history. When we talk of parental asthma, it's a very strong factor
That's
that can be linked.
history.
Yeah, that family history, meaning asthma at times or most times is familiar. So what that means is that for a child who is showing symptoms of asthma and we are not sure of it, even as early as 1 year, if you take a history and you find out that the father is asthmatic, the mother is asthmatic, then that's a strong factor, meaning that child could actually be asthmatic. So that's one strong factor. And that factor could be the job history of an individual, especially for adult asthma. We found that people who are exposed to air pollutants regularly, maybe their workplace 5 days a week, they keep on being exposed to air pollutants of different forms, gaseous or chemical, are also prone to adult onset asthma. So there are different factors. There are some that is basically allergic. You find that people develop asthma because right from childhood they've been having allergic skin disorders. So, and those are the common factors that we usually see when we're talking of what could be the cause of this asthma and why could this person have asthma. So another thing is some people are predisposed to asthma based on just common infections around. Infections could trigger it and then they keep on having it repeatedly. So when we talk of asthma, most of the time you can't really pinpoint and say this is the only thing that will cause asthma. It is multifactorial. And that's why the treatment is usually individualized for each patient. So each patient who is having asthma symptoms would know what is triggering their own asthma, and then they will be able to know how to handle such situations or such trigger factors.
Before I ask the next question, I would like to tell our viewers that phone lines are open, just in case you have any question you want to ask us, or you have any contribution you want to make to the program. The phone lines will be displayed on your screen. Yes, you can see them, so you can do well to get across to us to ask your questions. Now, my next question will be, how can an individual know that he or she is having asthma? Now, we do know that we've told our viewers most of the time, or they must have learned, that COVID-19 can actually present like asthma, okay? Difficulty in breathing and all whatnot. How can an individual know that he or she may be having an asthma? I know, of course, it's a diagnosis that a doctor should make, okay, but at least something must prompt such a person to start seeking for medical help.
Yeah, thank you very much, Dr. Barth. That's also a very important question. How can an individual know he or she is having asthma? So there are some telltale signs that asthma usually presents with, and they are common. And in medicine, we say common things occur commonly.
Exactly.
So for an individual, either a child or an adult or an adolescent, if somebody is having one of the commonest symptoms, I'll just talk about the common ones. Difficulty in breathing. Just start developing difficulty in breathing. Repeated cough. Not just the usual cough on and off. Cough that is persistent. Still with difficulty in breathing. You talked about some earlier, chest tightness, meaning that an individual wants to breathe, but he or she is feeling as if there's a pressure on his or her chest. Those are symptoms of asthma. Then also fast breathing, unusually fast breathing. An individual knows when he or she breathes normally. When the individual starts having unusually fast breathing, that's also a symptom of asthma. Then there are other symptoms that may not generally specific. Individual could have excessive sputum production. Individual could have repeated chest infections. But the common ones are usually the cough, difficulty in breathing, fast breathing. Then there's also one that is also very common, wheezing. And when we talk about wheezing, Dr. Barth also tried to explain it earlier. Wheezing means an individual is breathing loudly. It's form of a loud breathing. An individual is breathing loud. It's as if when an individual is breathing, the kind of noise you hear is as if you are passing air through a narrowed pipe.
Yes.
So the individual is breathing. Everybody, on a normal day when we breathe, the person beside you doesn't hear that you are breathing. But when somebody is beside you and then you can hear his or her breathing, it's more of a labored breathing.
Yes.
That's wheeze most of the time. And also it's also a symptom of asthma. Those are the common symptoms.
Thank you very much. Now, how can we relate all of these symptoms? Well, because I must be honest with you, some of the symptoms you mentioned a while ago are about the same symptoms that one can have if an individual is infected with COVID-19. How can we actually differentiate the symptoms in asthma from that of COVID-19 pandemic or infection?
Yeah, thank you very much, Dr. Barth. That's also a very important question, especially in this era we are in, global pandemic. So the issue with asthma is, as I said earlier, asthma is a chronic condition. So we've talked about these symptoms. So these symptoms are not only limited to asthma. An individual with asthmatic who has a chest infection, maybe a pneumonia, could have any of these symptoms I talked about, cough, difficulty in breathing. And after that episode, the person will be okay. But the thing with asthma is that it is usually present. There may be periods of exacerbation, which means there may be a period in which it is increased unusually, where the person will need urgent medical attention. But usually, for people with asthma, these symptoms, they are usually there at varying times. So for somebody, for example, now if you're talking of COVID-19, somebody has difficulty in breathing, somebody is coughing and is suspecting COVID-19, presents to the health facility, either it's positive or not, is taken care of, and the person is overcomes that condition and is okay. The person goes off. That condition is totally taken care of. The person is cured in that sense. But for asthma, there are usually period of exacerbation, which the symptoms will become exaggerated, and the person would maybe take some medications and get okay. But it will always come back. It will always reoccur, and that's why it's a chronic condition. So that would differentiate asthma from just a one-off pneumonia that would come and then will be treated and be healed. Asthma usually is not curable; it's a lifelong disease. So it will keep on coming. So it's someone that will tell you that I had this experience last year. I had this 6 months ago. I went to a pharmacy shop. I took some drugs. I felt okay, and I had it again. Or usually when I'm under stress,
in other words, the symptoms are recurrent and reversible. Okay, I will stop at that. We'll go on the short break and we'll be right back. Go nowhere. Thank you. Yes, we welcome you back to the show. And I want to start by looking at some of the common misconceptions that people have about asthma. And I'll be asking the experts on the building. Number one, sir, is asthma a childhood disease? Will it grow out as the individual advances in age? In other words, will it fizzle out? Will it disappear over a period of time? Let's start with that, sir.
Yeah, thank you, Dr. Barth. Very apt question. According to the body of science that is available as at 2021, asthma is not a childhood disease. It's one of the common misconceptions globally. Asthma is not a childhood disease. Asthma, as a matter of fact, can occur at any age. Asthma can start as early as before a child is 1 year. Asthma can start in adolescence. Asthma can start in adulthood. And we've seen cases of asthma in the elderly for the first time.
Wow.
So asthma is not a childhood illness.
Thank you very much.
To wrap it up, asthma does not go off as one ages, meaning that some people believe that children will outgrow asthma. That if a child has asthma, then by the time he or she is into adolescent age or adult age, they will outgrow it. No, it doesn't.
So what should actually be responsible? Because from clinical experience, I've seen children who were having loss of frequent attacks, asthmatic attack, while they were much younger, but in adulthood, the frequency appears to be waning, going down. What could be responsible?
Yes, thank you again for that comment. I think for a condition like asthma, as I said earlier, it's better to
Sorry, I will stop
individualize.
you.
Yeah.
I have John. Good morning, Mr. John.
Good morning, Doctor.
How are you today?
Fine.
Okay.
I'm enjoying your program.
Thank you very much, sir. We are glad to have you.
Yeah, thank you, sir. You are doing a wonderful job.
Thank you very much.
Happy New Month, Doctor.
The same to you and your family.
Yeah, we are okay. We are okay. Yeah. So my question is, Doctor, this asthma of a stuff, is it like, can another person contact it? Like, can you contact it from an individual? Is it how will I put it now?
Is it infectious?
Disease?
Is it contagious?
Yeah, is it communicable disease? Yeah.
Thank you. You took that question from my mind. Okay, that's one of the misconceptions. Okay,
Yes.
so let's see how true that is.
Yes.
Over to you, sir.
Yeah, thank you, Mr. John.
Yeah.
Yeah, for that wonderful question. So as Dr. Barth was still on the misconceptions you called in, so what you just asked is one of the common misconceptions worldwide, and Nigeria is not an exception, that asthma is infectious. However, science has shown clinically and evidence-based, asthma is not infectious. It is not. I can give you several examples. I have family members, close family members who have been managed for asthma, and I don't have asthma.
So it's not like COVID-19.
So, and we interact very closely. So asthma is not infectious. It is not at all.
Thank you very much. Now, should asthma sufferers be involved in exercise? Or if yes, what type of exercise, mild or intense exercise?
Yeah, thank you, Dr. Barth. That's another of the common misconceptions among the populace, that asthma sufferers should not exercise. However, this is not true. People with asthma can live their normal life. People with asthma can breathe normally like every other individual can do. The issue with asthma is that it needs to be well taken care of. In medical terms, we say it needs to be well controlled. When asthma is well controlled, individuals with asthma can do anything any other person can do. And when we mean well controlled, it means the person is constantly seeing his or her physician, as the doctor that is managing the asthma. Because one of the challenges we have is people with asthma, most of the time, especially in this part of the world, are not regularly being monitored by their physicians. So they are not well controlled. So to buttress the point that an individual with asthma can exercise and can get to the highest level you can ever think of, I'll give you some examples of notable sportsmen that have gotten to the peak of their career and they have asthma and they are managing asthma. The first example I'll give, I'm sure, even if you're not a sports lover, David Beckham. David Beckham is asthmatic.
Wow.
And the funny thing is that we all know he played for Man United. All through his playing career at Man United, most people did not know. Because you don't have to know. It is well controlled.
I didn't know.
The first time it got to the public was while he was now at the league in US. I think in one of the games he came out and he was with an inhaler and it was shown to the public. That was the first time. That was in 2009. David Beckham is asthmatic
Debayo.
and he's gotten to the
Just
peak
a minute,
of
let's
his career.
have Debayo. Good morning, Debayo from Lagos. How are you
Morning,
today?
sir. Hello.
Hello, good morning, sir. How are you today?
Fine, sir. Happy New Month.
The same to you, my brother.
Okay, the question I want to ask is that is there any way to treat asthma aside from the inhaler? Because at times they might misplace the inhaler or forget it somewhere. So is there any way, maybe like onions or pepper, to just
I like that.
like
Those are some of the misconceptions.
yeah, like I first said. And another thing I want to ask, that is it true that asthmatic patient cannot sweep?
Cannot swim?
Sweep.
Okay, sweep.
Yeah.
Okay, yes. Thank you very much. Okay, doctor will do justice to your questions. Thank you for calling.
Yeah, thank you very much for that question. Very also apt question. These are the kind of questions I also get from some of the patients I interact with whenever I have opportunity to. In relating to the fact that, the question that can asthma patients sweep, as I said, asthma patients that are well controlled can engage in any activity they want to. But there's a caveat to that. When we were talking earlier, we said there are some trigger factors. Maybe we've not talked much about that.
Yes.
Some of trigger factors, such as dust, heat, extremes of
temperature,
weather condition, temperature.
Yes.
So as I said, for every asthma patient, you need to be managed by a qualified health physician, a doctor. So when you go, part of the thing they will tell you, they will get you to know some the common trigger factors.
Yes.
And then as an individual who has asthma, you'll be able to identify those factors. And I said, asthma is multifactorial. Not all those factors would cause a trigger in an individual. It will be maybe just one or two. Some people it's just dust. And outside dust, no other thing will cause that trigger for asthma. Some people is stress. Some people it's just some odors, maybe perfume, maybe you said onion, different things. So individuals are usually encouraged to identify the trigger factors. And once you know those trigger factors, you, as much as possible, avoid them. However, even when avoiding them, you still need to have your asthma well controlled. And the thing about control is that it can only be objectively assessed by your physicians. So many people with asthma, they would, by the time you interact with them, we've done studies that have shown that they will tell you, doctor, my asthma is well controlled based on their own perception. But if you now take it to doing objective assessments, which you do in the health facility, objectively assess them, we have a way we assess them, we'll see that they are not well controlled. But they feel they are well controlled. It's until an attack occurs, then you now see, okay. But so that's why you need to constantly see your physician. But in terms of can they sweep, they can sweep if the asthma is well controlled.
You also asked a question,
yeah.
Just in case an asthmatic patient forgets his inhaler at home, what else can he use?
Yes, that point was also, I took note of that. That the issue of inhaler, are there other things that asthmatic can use instead of inhaler? Presently, science has shown, and it's becoming more evident, that the best way to manage asthmatics is using of inhaled corticosteroid. But I won't go much into the issue of drugs. But on the issue of inhaler, people that are placed on inhaled corticosteroids, they do not have to carry their inhaler all around, because most of the times the prescriptions are usually daily dose or twice daily, morning and night. So, and that's what we emphasize the issue of control. For somebody who is well controlled, you don't need to carry inhaler around. You use it in the morning, you put it at home. When you come back in the evening, you use it depending on the prescription pattern. If it's once a day, use it. But usually the challenge comes when an individual is not well controlled. An individual is not using his or her medications. And then the attack comes, and you now wonder, I'm not with the inhaler. So that's why I'll keep on emphasizing the fact that asthma patients need to be managed by a certified medical doctor. Because asthma is not like malaria, that you go and you get treated and you said, I don't have it again, and then until it comes after a year. No. Asthma is a chronic condition. It is always there. And science has shown that even those with intermittent asthma, those are those that...
Sorry, let me pause you a little. We have Mr. George from Plateau. Good morning, Mr. George.
Good morning. How is the day? And I'm wishing you a happy new month.
Same to you, sir. We are glad to have you on the show.
I'm enjoying your program. It's really educating us, and more grease to your elbow.
Thank you, sir. We appreciate you, sir.
Now, I want to ask, asthma is becoming rampant in our society now because of most of the fuel that people use, apart from anybody generator, all those funny air pollution. So what is the advice you're going to give to the federal government in respect of air pollution and all those things that is aggravating asthma? And also, what is the food that people can take? Some food for preventive and for also helping to reduce the aspect of asthma. So the food they can eat and things they can do naturally that will help them to release their asthma or manage it. Thank you and God bless.
Thank you very much. Thank you very much for those multiple questions. Very key questions, I must point out. And I'm sure Doctor will want to respond to that.
Yeah, thank you, Mr. George, for those questions. Very insightful. I would like to start from the last question. It said, are there foods that people with asthma should avoid? If I'm right? Yeah.
Yes.
So, basically, as I said, for most cases of asthmatics, they can live their normal life, eat whatever they want to eat, and eat like any other person. However, we've said there are multiple factors that could lead to asthma. There are people that the asthma is triggered by some particular drinks or particular food substance, usually because of the flavors of either those drinks or those food substances. Not necessarily because of the food, but usually the flavors, because most of the time it's the flavors of those drinks or those food that the individuals will react to. So for such individuals, once you identify such food substance or such flavors, then the advice is you should avoid them. Because even when you are well controlled and you expose yourself to those trigger factors, it could bring about another attack. So for example, I have a close relative that is well controlled, but whenever he takes vanilla ice cream, that vanilla flavor, once vanilla is in either a drink or food, the individual starts experiencing difficulty in breathing, and then if it's not well taken care of, it could lead to attack. So individuals who are asthmatic should identify those triggers.
Yes.
Because what science has shown is that most asthmatics also have allergies. I know that some examples of allergies. They have allergies to specific things. It could be to food, to drinks, it could be to perfumes, odors, and everything. So identify the allergies that the individual reacts to. Most times, the individual is the one that will be able to do that himself. And once you identify it, that's the best way. Avoid it while still on your medications continually and seeing your doctor. So, but once you identify it, then any other thing you can take, but that particular one you avoid.
Thank you very much. Now, is it only high dose of steroids, corticosteroids? We mentioned that a couple of times in the course of the presentation. Is it only high dose of corticosteroids that can be used in the treatment of asthma? That's one. Number two, we know that steroids have a lot of side effects. Of course, I've heard about the story of a lady who actually said that she became so fat because she was asthmatic and had to be on steroids for a very long period of time. Good morning, sir. Mr. GK.
Good morning, sir.
Yeah, how are you today?
I'm good, sir.
Okay, let's have your question, sir.
Okay, my question is good morning, sir. My name is GK from Benin State.
Yeah, go ahead, sir.
My question is, what is the link between fasting and asthma?
Come again.
The link between fasting and asthma.
Okay, the link between fasting and asthma.
Once you are on consistent fasting, especially if you are breaking with cold water, it will lead to asthma. So I want to clarify us on that.
Thank you very much, sir.
Thank you, sir.
You got the question.
Yes, thank you, Mr. Ejike. You asked about link between fasting and asthma.
Yes, and then sometimes when you want to break the asthma, the fasting, not asthma, I beg your pardon, with cold water, you it triggers an attack.
Okay. Yeah, thank you very much, sir. Based on science so far, as of 2021, there is no direct link between fasting and asthma. So, and as I said...
But can cold water trigger asthma? Because maybe that is what he uses in breaking his fast.
Yes. In some individual, some extremes of cold conditions, either drink, cold environment, could trigger asthma in some individuals. And that's why we talk about asthma management being individualized. So it's not a general thing. It's not that every asthmatic, I know asthmatics that take cold water without any issue. In some individuals, extremes of weather in terms of the water being cold or being hot,
or staying under the air-conditioned environment,
or staying in an air-conditioned environment, or staying in a very hot environment could trigger asthma for some asthmatics.
In other words, extremes of temperature.
Yes, but it's not a general rule that asthmatics cannot take cold water, or if you take cold water to break the fast, it will trigger an asthma. No, for an individual that is feeling after if he or she fasts, then after doing breaking the fast is triggering an asthma attack, most likely that person is not well controlled. As I said before, I keep on emphasizing this. Asthma control can only be assessed by your doctor. Your personal perception will not give you the right view of asthma control. And that's one of the things we've seen. We've done some studies that have just been released in the country 2 years ago, which shows that in Nigeria presently, we did a national study was conducted. In Nigeria presently, we have about between 10 to 11% of the population being asthmatic across all ages.
Wow.
And among that gives if you look at the figures, Nigeria being around 200 million, 10 to 11%, that's about 20 million Nigerians being asthmatic, roughly. And the study showed that about just 7% of the asthmatic population in Nigeria are well controlled according to the global guideline. However, in that same study, when those patients were asked about their control, about half of them gave the answer that their asthma is well controlled. So there is an inverse relationship between patients' perception of the asthma control and the real control of asthma objectively. And that's why patients continually need to see their doctors. You can't be managing asthma and just keep on going to
or continue to take the prescription that you were given 1 or 2 years ago.
Yes, without being assessed. You just say, you just go to the pharmacy shop, you go and refill. You need to be assessed
exactly
regularly. And doctor will determine it. It could be 3 monthly, it could be 6 monthly. On their occasions, it could be once a year.
So the summary of my question before the caller called in is simply, is there a relationship between asthma and obesity? Does it have to do with the drugs that people take? Do they become obese as a result of the medication they take in the course of getting treated for asthma?
Okay, thank you very much. On the issue of inhaled corticosteroid in asthma management, because of our viewers, most of our viewers are not medically inclined, so I wouldn't want to dwell too much on the drugs. But as you said, according to the recent science that we have in the world now, inhaled corticosteroids is becoming, it is the mainstay of management of asthma. And in managing asthma, you don't just give any dose of inhaled corticosteroid. And studies have also shown that inhaled corticosteroids has less and very few side effects when you compare it with oral corticosteroids. When people talk about steroids, people mix up the issue of the side effect of steroids, mixing up oral steroids, that's steroids you take by taking tablets, with the inhaled one in terms of the use of inhalers.
People who are asthmatic will know the drug, prednisolone.
Yeah.
Mr. Samuel, good morning. How is your state this morning?
Fine, sir. Good morning, sir.
Yeah, thank you.
Yes, I want to ask a question.
Please go ahead, sir.
Okay, is asthmatic, is it hereditary? And secondly, can someone outgrown asthma? Because I discussed with a couple of people. They said that when they had this attack, when they were younger. So now that they are grown up to adults, they don't no longer have this asthmatic attack again. Did they overcome it or have grown it with time?
Okay, thank you very much. I'm sure doctor will respond.
Also.
Thank you, sir.
Yeah, thank you, Mr. Samuel, for that question. Yes.
Thank you.
As you've asked, rightly asked, is it hereditary? Yes, in some individuals, asthma runs in families. As we said earlier, asthma can be familial. And it's one of the strong risk factors for developing asthma. If an individual's father and mother has asthma, the person is at higher risk. It's not 100%, but it's at higher risk of developing asthma. So asthma, yes, could run in families, but that's not the only pathway of asthma causation. But it's a very strong pathway. So that is very right. Asthma runs in families. Then for the other question, can a child outgrow asthma, or do children usually outgrow asthma?
Over time.
It's one of the misconceptions that we've tried and we've debunked this morning, and it's one of the things we keep on saying to educate people. Asthma is not a condition that children would just outgrow. No. Yes, you will see people that would, based on the individual experiences, they'll tell you while they were younger, they experienced more attacks, and now they are older, they hardly have attacks. You need to individualize the cases. Because I've talked about the types of asthma clinically. There are some we call the intermittent, which I said would occur once in a while. Most of those people will fall into that category of intermittent asthma, which would require medications only when they have.
And it could also be that the adults, over time, they must have mastered their triggers.
Yeah, and
they avoid them as much as possible. So that can actually be equally responsible for the reduced number of attacks in such individuals. I have a practical question. I have seen a number of my patients who said they won't allow their children to go to boarding school because they're asthmatic. What do you have to say to that? Is that the right decision? Can't children who are asthmatic go to boarding school, be allowed to go to boarding schools?
Yes, thank you very much, Dr. Barth. Very important and germane question. As I said earlier, I'll keep on saying it. People who are asthmatic, children, adults, can live their normal life, can do anything any other person can do once they are well controlled. So, directly answering your question, a child who is asthmatic can be in a boarding school, can be a boarder, and can be a day student. It depends on the choice of the parents. However, a child who is asthmatic that would be allowed to be a boarder must be well controlled.
And of course, the school authority should be notified too.
must be well controlled, meaning that the person is on constant medication and is constantly being reviewed by his or her physician, either at home or in the school. But if a child is not well controlled, then it's not advisable. So, but if a child is well controlled, meaning he's seeing his or her physician, then there's nothing stopping him or her. Because that's usually the goal of asthma management. The goal is to ensure that the individual with asthma can live his or her life to the fullest, can achieve his or her goal. And that can only be achieved when such individual is in partnership with his or her doctor and they constantly review the asthma and manage it.
Thank you very much. The next question, I'll have to relate it to my own self. A relation of mine has asthma and, of course, lives in the same house with me. Over time, I noticed that the attacks were becoming very frequent. And I, of course, with my medical knowledge, I was able to do one or two things. One of the things I did was to take away the rug that we have in the house. I made sure that all the rug, and I actually went further to do a whole lot of things, ensure that the floors were tiled and all whatnot. And then worked on a number of things. And after doing that, I can tell you that the number of attacks that person was having actually reduced over time. And with time, he could go for several months without having just one attack. But at the time, it was becoming much more frequent that he's always on one form of medication or the other in trying to avoid the attacks and then keep him healthy as much as possible. And of course, this takes me to what could be responsible for frequent asthmatic attacks in some homes or in some houses. Are there things we need to advise our viewers to look at?
Yes.
Thank you very much.
Thank you, Dr. Barth, for that very pertinent question. You've actually hit the nail on the head. What you just described is a common thing in our home settings, especially in this part of the world. People having frequent attacks based on the environmental conditions in their home. As you already said, rug is a common thing that most asthmatics react to. And why is that so? There's a particular factor. We call it dust mite.
Okay.
And it's very common in rugs. Dust mite is one of the common trigger factors for asthma attacks in patients.
Can it be seen with the naked eye, the dust mite?
No. It's just like it's difficult to see even dust.
How can it be eliminated in our homes?
So the best way of eliminating it is just to remove the rug.
Okay.
So make the house.
Can fumigation help in some cases to kill these dust mites?
Yes, if a house is already used to having a rug around for a long period of time, yes, as we said, there are dust mites. They can suspend.
Can they be found in our mattresses, our settee in the room, and curtains?
Mattresses, if it's open, yes. If it's not covered, a covered mattress. But usually if it's a covered mattress, you don't have much issue. So it's more of the rugs.
Thank you very much. I'm afraid that is how far our time can allow us to go today. So hopefully we'll bring back some other time, sir. I hope you don't mind.
Yes.
And it's on that note I want to say a very big thank you to Dr. Femi Omotosho. Thank you for coming, sir.
Thank you, sir.
As a matter of fact, we were classmates in OAU.
Yes.
Thank you for coming, sir.
Thank you, Dr. Barth.
Yeah, thank you. So we'll see you next week again.
Yeah. Bye.
Bye.